Following segment is sponsored by Bayer.
A new JAMA Cardiology study reveals a lot of Americans have prematurely aged hearts. What can you do today to help yourself and your heart? Bayer partner and cardiologist Dr. Jayne Morgan joins us with the scoop. Welcome, Dr. Morgan. It's great to see you.
Thank you for having me.
Sure. Okay, tell us about the study and what does it actually mean?
You know, you're right. This study is out of JAMA Cardiology, and it's super interesting because it confirms something that we've always known. Heart disease is the #1 killer of both men and women, and this study begins to tell us why. It shows that women's hearts are aging about 4 years faster than the date on their birth certificates, and men's hearts are aging 7 years faster than the dates on their birth certificate. So that means that everyone is getting that much closer to mortality, the exact opposite of longevity and healthy aging. So we need to wrap our arms around this and figure out how we can dial back the time on our hearts.
Yes, absolutely. Okay, and what risk factors are attributed to accelerated aging?
You know what? Great question. So some of the things that you may already know: high blood pressure, high cholesterol, diabetes, but maybe some things you haven't thought about: inadequate sleep or frequently interrupted sleep, or alcohol intake, vaping as well, not just smoking, and not just exercise, but activities of daily living, meaning movement in your everyday life, which most of us don't get thanks to the advancement of digital technology. We really don't move as a part of our everyday lives, but we've got to get back to that. And then, of course, we always must think about diet and what kinds of foods are going into our bodies, because food is actually nutrition and fuel.
Okay, good reminders. Very good to know. And what is an easy first step that you would say that we can all take?
Easy first step. Go to Bayer's website at seeyourrisks.com. S-E-E. yourrisks.com. Take a quick 2-minute heart health assessment. Get those results and talk to your doctor about them. It's a great starting point to have a conversation with your doctor about what you can do as well to take care of your heart. There are probably some things that you're doing well and they can be reinforced, and there are probably some things that you could do a little bit better, and then there are probably some things that maybe you need to start doing, and maybe some things that you need to stop. But this is the first step. seeyourrisk.com, get that assessment, and have that conversation.
Yes, we all have that time. We can take that survey. What do you think we should ultimately take away from this study, doctor?
You know what? Ultimately, we need to understand that heart disease is not a trend. This is something that is here to stay and actually has been with us for quite a while. And now we've got this first study beginning to tell us why. So this is something that we've got to begin to understand and dial backwards to make certain that we can live as healthy a life as possible, and that our heart age equals that of the date on our birth certificate, or even is younger. That's actually the goal for longevity and healthy aging.
Absolutely. We all need to take better care of our heart. Thanks for the information and the reminders. Thank you for joining me today, Dr. Morgan. It's great to see you.
Thank you so much.